The broadcast is now starting. All attendees are in listen-only mode.
Good day. Welcome to today's webinar on the NIH Public Access Policy, Information for Librarians. My name is Cynthia Dwyer with the NIH Office of Extramural Research, and I'll be your moderator today. Your presenters are Dr. Neil Thakur, Special Assistant to the NIH Deputy Director for Extramural Research. We also have Kathryn Funk, Program Specialist and Librarian for PubMed Central at the National Library of Medicine. We're pleased to be providing this event for you and look forward to spending the next hour and a half sharing important public access information. But before we begin, I'd like to cover a few logistics. One of our most popular questions has to do with the recording. Yes, we will have a recording of this webinar and the PowerPoint approximately 3 to 5 business days from today, and you'll be able to find it on the NIH Public Access page at publicaccess.nih.gov. For those of you who submitted questions during the registration process, you'll find the answers have been incorporated into the presentation. If you have any questions during the webinar, you may type them into the questions box located in your toolbar, as well as any technical issues you might be having. We will work in our questions and answers that come in live as we can during the presentation. You will also see during the presentations camera shots of Dr. Thakur and Ms. Funk. They are adjustable. Look for a small webcam button which will allow you to relocate the image, and the screen can also be resized. At this time, I'd like to get started with what you've all joined us to hear, Dr. Neil Thakur.
Thank you, Cynthia, and also thank you, Duran, for organizing this. And I also want to thank Annalise Taylor from UCSF for suggesting this idea and helping us get started. There's also going to be a webinar that's being put on by a few of the libraries next week, and I'll have more information about that later in the presentation. So what we're going to cover this afternoon is the policy, key steps for the policy, a new product you may have heard of, SciENcv, which is a profile and bibliography and biosketch system that we're rolling out. Policy questions that we've received from the registration forms, and Katie's going to describe for you the compliance monitor and how that works. For all of this material and even more material on public access or full training set of slides, you can find that stuff at our public access page under the subheader of training, and that's the URL if you want to go there. We already have training materials here now, and we're going to post this slide deck to the webpage as well. So what I want to talk about are the key steps that we ask awardees to go through. The first thing that awardees have to go through is to address copyright, to ensure that the agreements or publication policies for your institution allow you the right to retain the right to post the paper to the manuscript submission system yourself, if the publisher does not do so upon acceptance for publication. So either the publication gets posted directly to PubMed Central, or you or the publisher post that paper to the manuscript submission system upon acceptance for publication. So, and the second step is, again, deposit this paper to the manuscript submission system upon acceptance for publication. And I put that in red because this seems to be the biggest compliance challenge for our awardees. When an author is having an issue with public access, it's almost always because that paper wasn't deposited upon acceptance for publication. And as we'll talk about, papers get posted to PubMed Central in different ways. It depends on the publisher and the publishing agreement. But the awardee, that's the institution, is responsible for ensuring compliance. So what we ask is that authors think about how their paper is going to get into PubMed Central as they write the paper. So they can assign all the tasks required to get that paper posted to PMC as they're assigning the other tasks for, writing the tables or gathering the references or writing certain sections of the article. if they incorporate that into their planning, again, they're not going to have any trouble. We've developed this new wizard to help people figure out how to get their paper into compliance. It's accessible from the home page. They can put in their journal name, and they can figure out how to proceed. The third thing we need to do is we need to know that that paper has actually been written, and it came from NIH funds. So we need the paper to be reported to NIH. We have a method for doing that, but basically, whenever an awardee cites a paper to us in an application, proposal, or report, they have to include this PubMed Central ID, which is this index number assigned by PubMed Central. And that's described in more detail with all the different nuances on this URL on the website, on the page. So that's the fundamentals for the policy. And as I said, there were different ways to get papers into PubMed Central. The policy really applies by statute to the final peer-reviewed manuscript. That's the right side column. And when you're submitting the final peer-reviewed manuscript, we take that paper, we convert it into the PMC native format, that's the XML format, and we need that paper upon acceptance for publication. The paper is deposited into the NIHMS by either the author or their designee or the publisher. If the author submits the paper, we call it a method C submission method. If the publisher submits the paper, we call that method D, and we have a list of those publishers which are available at that URL. Now, the publishers are supposed to submit the paper upon acceptance for publication. Even if they don't, the awardee is still responsible for making sure that paper is submitted upon acceptance for publication. So that requires a little bit extra communication between the author and the publisher to make sure things are done on time. So that's the workflow when we're working with the final peer-reviewed manuscript. When we're working with the final published article, things can happen a little bit differently. Only publishers can send us the final published article directly to PubMed Central. They send it to us in PubMed Central's native XML format, and so the author doesn't have to go through the manuscript submission system, and NIH doesn't have to convert the document. Under method A, some journals will automatically submit the final published article directly to PubMed Central, and we have a list of those there. There's, I think, maybe about 3,000 journals that are working good with this method. We also have a number of journals and publishers that will send the XML directly to PubMed Central if the author makes a special arrangement. Usually that involves a fee. Those fees are allowable costs under the award, so the author can pay the special open access fee and then reimburse themselves from their NIH award. And that's at their author's discretion. So I mentioned to you this wizard on how to figure out how your paper is going to get into PubMed Central. It's accessible on the PubMed Central homepage. I'm sorry, on the Public Access homepage. This is the Public Access homepage, and that wizard is circled in red. If they click on that, it'll lead them through a stepwise process to figure out how they're going to get their paper into PubMed Central and how to bring it into compliance.
Oh, I have a question for you, Neil.
Okay.
While compliance is focusing on non-competing renewals, when will non-compliance become an issue for competitive and new submissions, as well as biosketches and other documentation?
Well, we don't have any plans to change how we're monitoring compliance for the policy so far. I don't see that happening in the short term anyway, because our compliance numbers are pretty good, and they've been climbing since we've made our most recent change in 2012. If we do make a change, we'll announce it through the NIH Guide for Grants and Contracts, which we do for all our other policies, and we will announce the change months in advance. So there won't be any surprises on that.
Okay, we also had a user ask you to please provide information about upcoming changes to biosketches. as this is a topic that many PIs and their assistants fret about.
Right. We have recently announced a pilot to change our biosketches, where we're extending the page limit from 4 to 5 pages, and with that extra space, we're asking researchers to describe up to 5 of their most significant contributions to science. So they're having some text where they can list some things that they've done and put it into context for us. And they'll also be able to provide a list of papers, a smaller list of papers, and provide a link to their full list of published work through that's available in any digital database. So they can provide a URL basically to their full CV. And you can do this through My Bibliography. With My Bibliography, you can generate a URL that'll link to your public My Bibliography papers, and also through SciENcv, which I'll talk about in a little more detail in just a second. And this pilot has been announced in a guide notice, which is accessible here if you folks wanted to look at. So I've been mentioning these systems. I thought it would be helpful just to give an overview of them. PubMed Central in the bottom right corner is our free text archive where all these papers are made available. PubMed, of course, is our index of and you can also the progress reports are actually fed by MyNCBI, which is our bibliography management system. So if you want to complete a progress report these days and report papers, you have to do that through MyNCBI. And so you enter your papers in MyNCBI, and then when you write your progress report on Array, there's a data feed between those two systems, and that'll create your progress report. The manuscript submission system is the way that we take in final peer-reviewed manuscripts and convert them to XML in PubMed Central. This new system that we're creating through MyNCBI is called SciENcv, and that's what allows you to generate your biosketch. So we have this existing workflow in Blue with all of these existing systems that our PIs have been using now for several years, and we're adding on to it this biosketch generation capability through SciENcv. SciENcv is our little acronym for Science Experts Network Curriculum Vitae. It's based on an interagency working group where lots of federal agencies are working together to generate this system where people can enter their papers, develop a profile, and generate biosketches. NIH is the first one. We're doing this in pilot. In the fall, we're going to have a pilot for the National Science Foundation as well, where you'll be able to generate NSF biosketches as well. So we're going to be encouraging more of you to get familiar with SciENcv, get your investigators, anyone who may write a paper, a student, a PI, a fellow, to have a SciENcv account and to start using the system. So as I mentioned, SciENcv and MyNCBI are related. I'm sorry, My Bibliography is a bibliography management tool. Not only does it feed progress reports, as I mentioned, but now it will start feeding SciENcv as well. It all falls within this MyNCBI umbrella, the same logons and so forth. And then these biosketches are PDFs that are generated, and that's the document you see on the left-hand side. And embedded within the PDF is an XML file that lists all the citations. So this gives us, even though our application system with our biosketch is still a paper-based system, it gives us the opportunity to mine this information for research and evaluation purposes as well. And so that's a feature that might be helpful to some of you who are interested in doing bibliometrics of the awards that are coming out of your institution. If they're your awards, you may have the ability to access these biosketches before they're submitted and get these citations in a structured format.
Okay, this is kind of switching gears back to the policy itself. Someone noticed that in the recent update to the FAQs, reference to editorials and commentaries are gone. And researchers are now asking if they need to be submitted and how to mark them in MyNCBI if not.
Okay. Well, that's a great question. I think we have been careful about wording like editorials and commentaries because an editorial or a commentary is used differently by different journals, and so the terminology isn't very consistent. Our policy applies to papers that arise from NIH funds and are peer-reviewed. And it doesn't matter what they're called, if they meet those criteria, then they fall under the policy. If they are not peer-reviewed, you can still report them to NIH, and you should if they're NIH-supported, and you can mark them as exempt in my bibliography when you submit the when you enter that paper into your bibliography. And the instructions for that are a little bit complicated, and rather than going through all the different screenshots for the different permutations, again, I want to point you back to this wizard, and the very first question that you get when you click on this wizard is, does this paper fall under the policy? If the paper doesn't fall under the policy, if, for example, it's not peer-reviewed, then it'll take you to instructions that will show you how to designate the paper as not peer-reviewed and therefore not applicable under the public access policy. Do we have I think we have a question, Cynthia?
Yes, we've had a few come in that I thought I would bring to your attention. The first one is, just in case they missed it, we were having some echo issues, but if you have to submit to PMC upon acceptance for publication, wouldn't it always be in manuscript form and not final published form?
Yes, and that's a good question. And that's why the only way that you can not submit to the manuscript submission system is if you're using journals which have specifically been designated as Method A journals, and that is a list that we maintain because we have signed agreements with them, or that you tell us you have made a special arrangement with the journal under Method B, and again through a list that we've maintained. And that way, when you designate a paper as Method A or Method B within my bibliography, you're telling us that we're going to be expecting that final published article in XML, and then that different workflow takes over, and then that paper does not need to be submitted upon acceptance to the manuscript submission system. And again, helping you figure out what's Method A, what's Method B is also covered through this this wizard that we were talking about. Do you have another?
Okay, I have come across several PIs who are not in compliance, and the PI is under the impression that the journal that the journal is going to submit, but months have gone by. I have suggested that they submit it themselves. Is this appropriate?
It is appropriate if they have the right to do so. Sometimes in their publication agreement, the author signs away their right to submit a paper to the manuscript submission system. In those cases, they need to get permission from their journal. And that, so there's two things that come up here, and both of those require an institutional response. So some institutions have policies where the author really can't sign away their right to comply with the policy. And if you're working in one of those institutions and you're following those policies, you can submit that paper. In other cases, the author needs to work something out with the journal because something has gone wrong, and in those cases, we encourage the institution to communicate with the author rather than the author trying to communicate with the journal and getting lost in customer service. We have this issue with our own scientists who work for NIH, and we find when NIH talks to the journal, it's a lot easier than when the individual scientist talks to the journal. To go back a little bit and to show you what happens when you click on this wizard, the first screen it takes you to is this, as I mentioned, this determine applicability screen, and this is a very simple tool. If you meet the criteria, then it clicks you on to another set of questions that help you figure out your submission method. If the paper is, for example, not peer-reviewed, it'll show you how to enter that paper and document that it doesn't fall under the public access policy.
Okay, we got two previous user questions about this feature. It says NIH guidelines for non-applicable papers outside of MyNCBI say that only the full citation is required. Some authors are adding a notation to indicate that these papers are not applicable, in part for their own information. Do you have any recommendations for this kind of notation?
Yeah, I would recommend that the authors don't make up their own notation. We don't know what to do with it. It doesn't really have any meaning for us, and it can cause a lot of confusion. The nice thing about my bibliography is it creates the citations in the right format, and it also gives the authors a clear indication of what falls under the policy and what doesn't. And so if they're working for my bibliography, they don't need to have a separate way of tracking statuses. And if they're reporting papers outside of the my bibliography systems, they just don't need to worry about it.
Okay, and along the same lines, what kind of results are authors having with inputting papers as forthcoming in MyNCBI, then having those records merged once indexed by PubMed, so a case of duplicate citations? Some faculty have argued against doing this, saying the practice cause them problems because they end up with duplicate records.
That's a great question too, and it's a little tricky because it depends on the submission method that they're using. And so we have, as you remember from that slide we had before, we have lots of different data systems that are all feeding my bibliography and MyNCBI, and thank you. And so and these systems sort of align up in different ways. And so if you're submitting a paper to us through your progress report, we need that paper obviously upon acceptance for publication, but the PubMed record hasn't been created because the paper hasn't been published yet. And so what we ask is that the author puts in that record before the paper is published, and then what my bibliography does is it checks PubMed every day to see if that paper's been published, and then if it has, it tries to merge those two records together, the published record with the in-press record in my bibliography. And it usually does a really good job, but on occasion it misses something, and when it does, we have instructions on how to combine those two papers, and those are addressed in our FAQ under my bibliography. And we also have, if you follow through on this wizard, for each submission method we have fairly detailed instructions on where to create your citation, when to create your citation, and who to link it to help these papers get to not only the person who's entering the paper into their bibliography, but also into the bibliography of all the PIs that need to write on the paper, need to report on the paper. So again, for that question, there's some nuances to it, and I would ask that the authors refer to the wizard, this wizard right here.
Okay, I think we had a few other My Bibliography related questions. Neil has kind of talked us through this diagram. We did have someone ask whether authors are required to use MyNCBI to manage citations, or is it an optional tool?
MyNCBI now is the only way to enter papers into electronic progress reports. So effectively it's required for awardees.
Okay.
I have a question for you, Katie. Is it possible for someone like a grants officer at the university to print out a publication report for MyNCBI on behalf of the author? This would be akin to the PACAR rule for the Public Access Compliance Monitor that provides institutional access for any PI's bibliography.
Okay, this is one of those questions where, yes, it is possible. I would say this with the caveat that it kind of depends on how many grants you're interested in doing this for. If it's just within your own department and it's a few PIs, then I think My Bibliography is great for helping out PIs with this. There is a delegation tool. A PI's bibliography is by default private, but they can set it up as public, or they can grant access to another person, the delegate, to view and manage their collection. The delegate should be able to see the awards view, so they'll know the compliance status of the paper. They can add citations, they can remove citations, they can essentially manage it for the PI. We'll also talk about the compliance monitor later, which if you're doing this more on a broader institutional level, that might be a better tool, but the delegation option is there for anyone who would like to use it. And that's another thing that's covered in the My Bibliography. I think that's in the help information, and it will talk you through setting that up. Okay,
thank you. I have another one for you. What happens if someone adds a paper more than once to My Bibliography? Will my NCBI recognize the duplicate and ignore it, or does it add it again and you get 2 records?
Sure. So resolving duplicates is, Neil touched on it a bit. It is a problem users run into, and there can be a couple reasons for it. MyBib is always looking for the duplicate citations, so it'll sometimes flag that you have an issue, and you can just use a wizard to collapse the 2, and there are instructions for that in the FAQ. And the issues kind of vary by whether it's a manual citation you've entered or whether it's a PubMed citation. In cases where you have 2 PubMed IDs for the same citation, this might happen if the publisher submitted it ahead of print citation and a final publication citation to PubMed, and PubMed just hasn't caught it yet. In those cases, you'll want to write to the help desk because staff can resolve those issues. Similarly, if you have an issue with 2 NIHMS IDs attached to 2 citations that should be collapsed, you'll want to write to the NIHMS help desk because those things can be resolved by staff. So there's a few options, and all of those are reviewed in the FAQ.
Well, thank you. We got another question about My Bibliography, specifically about the other citations feature. The PI at their institution has applicable papers that they're not an author on, and they don't want to add those papers to their My Bibliography. Should they put them in other citations and then add his other author papers on that list to generate a single report?
Sure. You can actually create, I believe, as many bibliographies as you'd like. So other citations is a great place to put citations that you don't want on your main bibliography. If you eventually think you might want to run a report on them, when you go to fill out your RPPR, there is a section that includes the citations from other citations, so you can pull those in as well. It has the same reporting and compliance monitoring functions as My Bibliography, the main one, so they're really kind of interchangeable, and it's entirely up to the PI or his delegate and their needs as to how they'd like to organize this information.
So to clarify, there are only 2 collections under My Bibliography, the main one called My Bibliography and the other one called Other Citations, which are connected to ERA. And the PI can create other collections and call them other things, but those things aren't connected to ERA. Is that right?
I think so.
Okay. That's my understanding as well. Do we have a couple of other questions on My Bibliography?
We do, Neil. We do, Neil. One is, we've run into a problem with articles not in PubMed. Even when entered in MyBib manually, sometimes we can't pull it from MyBib in NIHMS. It won't find it even though it's in MyBib.
So,
I think I can speak to this at least partially, and then feel free to expand on my thoughts. A manually created citation in your bibliography, if there is no PubMed ID yet, it allows you to enter citation information. A PubMed ID won't be created, though, until for these journals that aren't going to go automatically into PubMed, it won't be created until the NIHMS process is complete. So you'll get the PubMed ID and the PMC ID at roughly the same time. So you'll just want to make sure that the citation in your bibliography is attached to the NIHMS ID, because that's how it will know when this has all been updated.
Right. So if your author publishes in a math journal that isn't normally indexed in PubMed, as long as they have that NIHMS ID in their bibliography, that'll connect to the PubMed ID when that paper shows up in PubMed Central.
And these connections can sometimes take 24 to 48 hours to be reflected in all of the databases. There is some uploading of information that has to take place, so you may sometimes have to account for that.
Did you have a... No? Okay. While we were waiting, we got a couple of questions about SciENcv. How does ORCID play into SciENcv? So SciENcv does support ORCID, and you can enter your ORCID ID into SciENcv and then pull citation information from ORCID into your SciENcv and into my bibliography. ORCID has a profiling system where you can enter papers, and we have a way of importing that information from ORCID. ORCID is still getting set up. SciENcv is still getting set up as well. So these connections aren't as smooth as we expect them to be in their full implementation, but they're there already. We also got a question of, are SciENcvs linked from Reporter, or how do SciENcv and Reporter work together? Reporter is a system not on this list that shows NIH awards and any kind of product that we can identify as resulting from that award. And so if you link a paper to an award in any of our systems, through the NIHMS, through my bibliography, if someone writes it in the paper and it shows up in the acknowledgments, that information will get captured, and the paper will be associated with the grant, and that grant paper association will show up in Reporter. So SciENcv, since it's part of my bibliography, any grant paper associations you make there will show up in Reporter as well.
Okay, so moving back to my bibliography, which is integrally tied in with SciENcv, this is, most of you are probably familiar with it, what a user would see once they click on Add Award. And a couple folks had questions about this display, especially in regards to complex grants that have several PIs or sub-projects, and so we can address those.
So the first question we got was, what's the plans to consolidate grant numbers in my bibliography?
Okay, so this is a tricky one, and I'd like to say they're brilliant plans, but part of this is tied into how information comes into my bibliography from ERA Commons. And so there is the one main grant, which is what the user is going to report on, but we also get fed the sub-project information. So a lot of times you'll start typing in a grant, and if there are sub-projects, you'll see the grant number multiple times, and you'll need to click on one of those before you see the list of all the PIs that are associated with the main project and the sub-project. There isn't a really effective way to consolidate these at this time, but we are aware that it's causing some confusion, and so we're looking into it.
So we've done a couple of other things too based on the feedback we've gotten. One thing we've done is we have dropped end-of-year suffixes from awards. So it used to be that the 01 award for the first year of the award would be listed along with the same grant number followed by 02 for the second year of the award, and we've dropped that. Now we're still maintaining the end-of-year suffixes, the 01, 02, 03, for the papers back when we collected information in that way. And so what we're in the process of doing now, I think in the next few weeks you'll see a change, is we're going to get rid of those end-of-year suffixes, and so you'll only see that grant listed once, even if someone listed a paper and associated it with two different grant years. So that's one small step to make the system a little bit cleaner. The other thing we had a question that Katie touched on was this issue about sub-projects. And one of the advantages of my bibliography is that if everyone uses my bibliography, that is all the authors associated with the award are using my bibliography, and they link it to that award, it'll show up in the PI's my bibliography, and the PI doesn't have to do the data entry. And that helps them do their reporting much faster. With sub-projects, it can get a little tricky. So what we ask, what the best practice is right now, is that the author link the paper to both the sub-project that funded it and also to the parent award. And we do have in our FAQ descriptions on how to identify what's the parent award. Yeah, so I think with large grants, that's and these complex grants, that's a key issue, is to link it to the parent award.
All right, another policy question. How to deal with older articles, so anything pre-policy that are non-compliant.
Well,
or actually, these are not pre-policy, these are just old.
Well, so that's a great question, and it's important to get these older papers into compliance, because some of these papers have been recorded and associated with the award electronically, and even if they were reported to us in the past and that didn't cause an issue with funding, they can cause an issue with funding in the future. We do have a way of tracking these grant paper associations, and if a paper was, say you started a submission but then you never finished the submission and the paper was provisionally compliant but is now not compliant, it can cause issues with the progress report and hold it up. So these older papers do all have to be in compliance. There's really two issues. The first is the older article may look like it falls under the policy because of its publication date, but it may actually not. It may have been accepted for publication before April of 2008, which is something that we don't really know. And so the author, when they enter that paper into my bibliography, when the PI enters that paper into my bibliography, they can use that wizard and find the advice on how to designate that paper as not applicable because it was accepted for publication prior to 2008. Otherwise, they need to get that paper into PubMed Central by whatever the appropriate submission method they have. And this ties back to that question we had previously about what if it has to go through the manuscript submission system and they don't have the manuscript anymore, they only have the final version. Whatever version is submitted to the manuscript submission system, it's always going to be formatted as an author manuscript. It's never going to be formatted as the final published article. And so if the author signed away their rights to submit that paper, then you have to figure that out and work with the publisher to make sure that you can have the rights to submit that final PDF, and then we'll convert it into an author manuscript. So thank you for that. So this brings up to how institutions are ensuring compliance, and I say institutions because in some cases the offices of sponsored research play a role, but in many other cases, as most of you know through direct experience, the libraries play a huge role. So training is obviously very important. At NIH, our library does a lot of the training for folks, and we have slides on our website that you can download. They're in PowerPoint, so you can reformat them and rebrand them and make them your own. And I encourage you to do that. We also have folks who provide support for their authors. That could mean submitting manuscripts, answering questions. Some institutions go so far as to send out reminders for progress reports to say you have a progress report. Check before you submit your progress report, well before you check, make sure your papers are in compliance. And they also provide some advice to authors, to awardees, who work with a lot of collaborators. Sometimes people have resources that they distribute, or they work on a consulting unit of some sort, and they're supporting lots of different people, and they want to include the publications that come from those collaborations as the product of their award. And once they do that, those papers fall under the policy and they public access policy, and they have to be in PubMed Central. And so how do you let your collaborators know that this resource or this support is coming with the strings of NIH funding? And that's somewhere where an institution can help. They can provide all the right information, not just for public access, but all of our other ethics policies and so forth, to let authors know that they have to get the paper to PubMed Central. And we've talked a lot about discussions with publishers and other support for publishers. So one is the actual negotiation or discussion with publishers, and then the second are these policies. And so as I mentioned before, some institutions have a policy where the authors can't sign away all their rights. At NIH, we have the same sort of idea with a cover sheet. And so as an author, I'm not allowed to sign a publishing agreement. I can only submit a cover sheet. And that cover sheet reserves certain rights for NIH, so I can comply with the public access policy. Other institutions are doing this as well, and they may have examples you want to look at. I think some of this stuff will be addressed next week as well, by how different libraries are addressing these issues. And then finally, institutions also have the ability to ensure compliance by looking at applications and reports, especially progress reports, before they go out. I get a lot of email questions or help desk questions about people asking to amend their progress report after it's been submitted because they reported papers that were written before the award started. And so they're over-reporting, and they're over-reporting papers are out of compliance, and then it's holding up their award because their award is out of compliance. That's somewhere where the Office of Sponsored Research or someone else in the university can be coaching some of these investigators to just really be careful about what they report and only report papers that really arose from their award. And also, Katie will be talking about the Public Access Compliance Monitor, and that's a way to look at compliance overall. Did we have a question, Cynthia?
We do. We have. Before we move on, let's. There's a couple questions that have come in that I think we have time for. One is, you had said that the ORCID is linked to SciENcv, which is linked to My Bibliography. Is there a way to use My Bibliography to update ORCID so authors can have only one account that needs to be updated?
That's a great question, and I think, although I'm not sure, I think right now the link is one way. So information can go from ORCID into SciENcv, but I don't think information is going out of SciENcv into ORCID. I know that's something that we're working on for future updates, not only where you can update ORCID, but update other existing profiles as well. But right now that's not in place. One thing you can do from both SciENcv and My Bibliography, as I mentioned, is you have a URL that you can give out to people so you can have a public profile. I believe there's also the capacity for HTML code if you want to embed your papers into an existing profile web page that you may have. Yeah, I think that's right.
Okay, will SciENcv be tied back from ORCID to SciENcv to MyBib for completion of progress reports and compliance?
SciENcv is an extension of My Bibliography, and so you're going to be creating your progress report through our grants management system, ERA, which is being fed from My Bibliography. SciENcv allows you to create a public profile and create a biosketch, and you're entering publications into SciENcv through My Bibliography. So My Bibliography is the parent system where you enter papers, you can sort them and manage them and so forth.
Okay, we'll go for two more. How do you go about disassociating a grant from a publication when they are connected erroneously?
Well, it depends on how they're associated. So that's a great question. So if they're associated in the manuscript submission system, I go through the manuscript submission system, I enter paper, and then I enter a grant, that will appear in your My Bibliography account with a gold padlock. And so to get rid of that gold padlock, you have to email the manuscript submission system help desk, and they'll get rid of that gold padlock for you because they'll break that association. If you've actually reported the paper to NIH in a progress report, we have to effectively revise that progress report, which was signed by the institutional official. And so you're changing that official report, and to do that, we need permission from the funding IC, like the National Cancer Institute, for example. We need them to tell us it's okay to amend that report. And so what we ask is that you have the program officer for that grant email the Public Access Help Desk, and they will tell us, please remove this report. We'll manually go into the system and remove that association. And we have FAQs on both of these scenarios because I realize this is a little bit detailed. The final scenario where a grant can get linked to a paper is if the grant is acknowledged in the text of the paper, and then it's picked up by our indexers at NLM who put that paper into PubMed, who put that association into PubMed. Now, that association is not official. It doesn't count towards your funding in any way because you're not reporting to us. It solely exists in the paper. But sometimes people feel that association is inappropriate, and in which case you really have to work with the publisher because you're talking about editing the published record to remove that association. But it doesn't count against your funding, it doesn't count for public access compliance if it only lives in the acknowledgement section.
Final question
Okay.
before we move on.
Okay, final question before we move on. We've had issues with papers that turned quote-unquote yellow, and then even after the authors have done all they can and it's in the hands of NIH staff for processing, it still remains yellow and they're still unable to get their funds. Is there anything that can be done to indicate that it's now in NIH processing?
So our My Bibliography has, in the award view, has 3 different statuses. One is fully compliant or complete, and that has a little green label next to it, and that paper has a PubMed Central ID. It's in PubMed Central. It's completely compliant. Another status is red, and those papers are not compliant at all, and they say not compliant. But the statuses that are yellow are actually provisionally compliant. And so they'll say something like, they'll have an NIH ID, or they'll say PMC journal in process. And that yellow status is a fundable status. So if for some reason they have a yellow status, but we're not funding it, that's the kind of thing that they should send to public access at nih.gov, and we'll look into it in a little more detail and figure out what's going on.
All right. Great. Okay, we're going to switch gears again. Still tied, of course, to public access, but this is about the compliance monitor. We often refer to it as PACM. Neil has suggested just calling it the compliance monitor because we might be on acronym overload here, so I'll try to stick with that, but if I fall back into my old ways and say PACM, that's what I'm referring to. So I have a feeling, based on my interactions with a lot of folks in the library community, that you're probably familiar with this tool, but if you're not, the compliance monitor is essentially a database of articles that includes the current compliance status of the article, as long as it's associated with your institution's IPF, and that falls under the NIH Public Access Policy. And we'll get into the details here, but essentially the goal is just to give you the data you need to help monitor compliance for your institution, regardless of whether you're in the Office of Scholarly Communication or the library, whoever is involved in this process, we want you to have access to the data. So where is this data coming from? All the records you'll see in the compliance monitor are PubMed ID based. There won't be those articles that you have to create manual citations for in MyNCBI. Those won't be in PACM until they have a PubMed ID. So the idea here is if you can get everything with a PubMed ID compliant, you're in good shape. And nothing that doesn't have a PubMed ID should go out of compliance, so that's useful. A lot of people ask how often we update the compliance monitor. It's twice a week. I can't off the top of my head remember what days it is. I have in my, I'm thinking Wednesday and Saturday, but that, who works on Saturday? I mean, so it's something similar to that. And then the final kind of issue about data in PACM is where it's coming from. So Neil touched on this. It's NIHMS, any grant paper associations made there. My Bibliography, if you've attached a grant to a PMID in MyBib, it'll show up in PACM. And then there's the Medline indexing. And the one issue with Medline indexing is if the wrong grant was put in the acknowledgments, a lot of folks write in and ask that record to be removed from PACM. And Medline indexing is something that requires a change to the version of record, like Neil said. So unfortunately, we usually have to send you back to the publisher if you want to get that grant paper association broken.
Katie, we got a question about this. The question was, the PACM data are frequently out of date when they're called on with CIS researchers. Are there plans to improve the monitor so results are available in real time?
Okay, it's a very good question. Right now, the plan is to continue to just update twice a week. Partially, this ties into the idea that it does take a while for all the IDs to update through our various resources. So even if it was real time, you probably would not see it instantly. If you're checking once or twice a week, on the compliance monitor, you're probably doing more than your due diligence in helping your institution stay compliant. I had received a suggestion recently about including the last updated date in the compliance monitor, easily viewable wherever you are, and I think that's a great idea. We're looking into it. So that might help resolve some of these questions. The one other thing that I think is worth touching on is sometimes the issue is not with when PACM is updating. Sometimes it has to do with when the IDs are linked. So if you have a PubMed ID, you know the author submitted it to NIHMS the day before, it is going to require NIHMS staff to link that NIHMS ID to that PubMed ID if the author did not do it at the time of submission. So there's sometimes these delays that just are a product of PACM not knowing that there is that connection to be made. If your authors are concerned, or if you'd like to help them and you know their articles are in PubMed, there are ways. When you go into the submission system, you have the option of searching PubMed for that article and just linking it directly to the PMID, and then we'll have that ID association made right away. So it will make things a little quicker, but by and large, once a paper is submitted, NIHMS staff should make the connection within a few days. There was a lag there for a while, but that's been resolved. So I think that covers most of the data issues.
Yes, thank you.
All right. So then, if you want to use the compliance monitor, how do you go about this? You can really Google the compliance monitor. It's useful like that. And you'll come to this page. There's not a lot going on there because pretty much all the data is behind. It requires a login. You can't just log in because you want to. You have to get a PACR role, and that can be assigned by the administrator at your institution who's authorized to assign these roles in ERA Commons. Just a few tips in relation to questions that I get occasionally. Once you have the PACR role, you definitely need to wait 24 hours before you log in. Again, it's just a matter of PACM knowing that you have the authority to do this. If your institution has multiple IPFs, you'll need a PACR role for each IPF to see the complete comprehensive look at all the data associated with your institution. And then the third and probably trickiest trick is that ERA Commons is the one who manages the login system. So this leads to some confusion because you'll click on this login via My NCBI button, and then you need to click on the NIH login. But if you have password problems and you need to change your password, you're actually going to need to reset your password in ERA, not in NIH. And I know that's not terribly intuitive. We've tried to update the password reset options page, but people are still getting a little confused. So if you ever are locked out because you haven't logged into your ERA account recently and the password is changed on you, you can click on the change password and then you'll see the ERA Commons. This arrow is intended to indicate where you can change your ERA Commons password. So that's one of the tricks, and someday we'll hopefully have an interface that doesn't have this issue, but in the meantime, that's your workaround.
Hi, Katie. We have a couple questions, related questions. This individual says, I have no idea who the compliance monitor administrator is at my institution. Is there a way to find out easily?
It's the signing officer.
Yeah, they should check with their Office of Sponsored Research, and whoever is their authorized signing official will know if it's not them.
Okay, great.
Okay, great.
Another question,
something that they've run into. A paper somehow gets a NIHMS record even though neither journal or author has entered a manuscript. It gets stuck, quote unquote, at manuscript entry and turns from yellow to red before anyone looks at it. Where are those coming from?
Well, usually, the vast majority of manuscripts that are submitted to NIHMS actually do come from Method D publishers. I think it's something in the realm of 70%. The public access compliance monitor, and I'll show you this in more detail later on, but it does have fields for the submitter and also the latest actor in NIHMS, so you should be able to see who is submitting the manuscript.
I got one as well. This is from someone who said, I always have trouble accessing the compliance monitor. I am unable to save a password and have to ask for a new one every time I try to access. The system doesn't let me save it, so I have to write for a new one over and over. What am I doing wrong?
Okay, I think that's actually tied to this ERA password issue that I tried to illustrate here. ERA does require its users to update their password on a fairly frequent basis. So if you're not logging into PACM weekly or something, I can see how the password has expired or you've forgotten it. So in those cases, you're probably just going to want to use these steps. If you go through this and you still have trouble getting into PACM, write to the public access help desk and we should be able to help you.
Thank you.
All right, so you have your PAC-R role, you're in the compliance monitor. This is what you'll see, and what's going on here is you can set a time frame. So some people like to look at it for the entire length of the public access policy, so from April 2008 until the present. Others are just focused on what's going on in the last 6 months, so it's entirely up to you. And then you can get this snapshot of compliance at your institution. So highlighted in red is the dates, and then down here is the snapshot. So you'll see the total number of articles that have grants from your institution associated, and then the breakdown by the 3 different compliance statuses. So in this case, they have 2,500 compliant, 606 non-compliant, and 16 in process. To find out more about any of these states, you would just click on the number itself, and that will take you to the details by the status page. So what I think is really useful here is, well, you can navigate in between compliance statuses, but more importantly, you can download this information as a CSV file. And CSV file is great because you can filter it. So this means maybe you want to help the medical department at your school, and you know they have these 12 grants, so they don't want to see the entire compliance monitor data. They just want to see these 12 grants. So if you open the CSV file in Excel, you should be able to filter it down by just the grants you know that department will care about, and that will give them the information they need to work with their faculty and their researchers to get these compliant.
So Katie, can I ask you a question about
Yes.
that? So one of the folks who registered asked, for multi-institutional publications, that is a paper supported by grants from different places, what dictates which institutional PACM profile is the manuscript is listed with? What are the reasons that a manuscript would not be included in an institution's profile?
Okay, so these associations, the ones that are listed, that data, the IPF, comes from ERA Commons. So if a grant is made to an institution, and that institution is associated with an IPF, and that's the kind of indicator that PACM uses to associate grants with publications. The reason you might not see a publication that you think a grant was supported by is because your institution has multiple IPFs. The PI may have set one of those exclusions that Neil mentioned earlier. So if a PI goes into my bibliography and says this was not peer-reviewed, it will not show up on your report because you do not need to monitor the compliance status of that paper anymore. In December, we took off any pre-fiscal year 2008 articles or grants, so those shouldn't be impacting what you see in your report. So if you notice a few things disappear, it's probably because the grant closed before the public access policy came into effect. And this is the case more often than not, the PI just has not associated the paper with a grant. Until they go into either my bibliography or NIHMS and make this association, unless they included it in the acknowledgments of the paper, we don't know about it. So these things, it's usually best to check with them first to make sure that they've made the association, and if they have and it's still not showing up in the compliance monitor, feel free to check with us.
I got a couple of other questions.
Okay.
One is, can multiple users have access to the compliance monitor from a single institution?
Yes, it's entirely up to your institution and the signing officer, but we don't put a limit on it.
Okay. I got another one. Do you know the average institutional compliance rate?
Should you take that?
I could try. We looked at this, and the data are a little skewed because there are several hundred institutions that only have 1 or 2 publications. And so they could have a compliance rate of 100% or a compliance rate of 0. But if you look at the institutions that have a fair number of papers a year, I'm guessing it's in the mid to low 80s. But that's a guess. I haven't actually compiled an average. That's a guess.
Okay, so these reports that I was mentioning earlier that you can download as a CSV, this is just kind of a screenshot of what one of them looks like, the first few rows. And I'll just go over kind of the fields that you get here. So the first 3 columns are these identifiers that keep coming up. So your PubMed ID, the PMC ID, and the NIHMS ID. The grant information is next. That includes the grant number and the PI. Now, when you download the report, you'll be able to see, I think on this one you can see the 2nd and 3rd lines are the same PubMed ID. That's because there's 2 grants associated with them. So you'll be able to see the names of both PIs that are associated. It's sometimes useful to have more information than less, especially if you need to get in touch with someone about finding a copy of the paper or something. Then there's some article info. It's not all together. There's the publication date, and then further along is the article title, the first author, which is usually useful information, but which I've blacked out here so that no one doesn't have their name showing up in a slide randomly. The journal title, the publisher is very useful, especially in times of do you have the right to submit or not. And then method A journal, yes or no is all you'll see there. And we can discuss that more later. If a paper is non-compliant, though, it's always going to say no. That's the nature of being non-compliant. And then finally, you get NIHMS info. And these are some key dates, as well as the person who is acting on the NIHMS record at that time. I've included a link here as well to a document made by the Washington University School of Medicine in St. Louis's library, Becker Medical, called Understanding a Public Access Compliance Monitor Report. It's incredibly useful and goes into more detail than I just did, and I highly recommend checking that out, as well as some of their other resources. They've done a great job. So these dates in PACM, a lot of people aren't sure what to do with them or what they mean. So this is kind of intended to give you an idea of what dates are associated with what steps in the NIHMS process. So the first date you see in PACM is when the files were deposited. It's fairly self-explanatory. That's when either the publisher, the author, or a third-party assistant or librarian came in and submitted the files. All NIHMS submissions have to be approved by an authorized reviewer, and that reviewer is usually an author. It doesn't have to be the corresponding author, but someone who can review the paper, speak to its scientific accuracy, and make sure everything's there. They also, when they sign off on it, they're saying they have the rights to submit it and that it should be in PMC. They can add grants at that time as well. So those are the first 2 steps. In some cases, if an author does both of them, you'll see the dates are the same. But in most cases, the files will be deposited, and then a few days later, someone will approve them. If you see files were deposited in March and nothing's happened, then you would want to follow up with the approver or contact the NIHMS help desk and see if you can get the paper record reassigned to another author to act as the reviewer. So once it goes through this initial approval process, it goes into this staff review and conversion. Staff is really reviewing to make sure the submission is complete. So if you ever are looking for shortcuts to avoid delays, make sure that anything that's submitted, if it references tables, figures, or supplementary materials, that those have been deposited as well. I'd say one of the most common reasons something might get sent back to the submitter is because a paper talks about 5 supplementary figures, but they weren't submitted at the initial submission step. Once the deposit is complete, we convert those Word files and PDF files into the PMC format, so the tagged XML. And once the tagging is complete, you'll see another date in PACM. The final approval then is when the author has been notified that the paper is available in PMC format and they need to approve it. This is just like with the initial approval. If there is a date that's set in June and for tagging complete but no one has performed the final approval, you're probably going to want to follow up with someone because those are the 2 spots where things can get stuck.
Katie, I got a question on this too. Is it possible for the delay period between the 2 approval steps to be shortened?
Yes and no. So we're in the process of doing some updates to shorten it. I think you'll notice that it's already fallen by several weeks. It is dependent on the volume of submissions at the time, though, because XML conversion does take, it's not an overnight process, so it does take a few weeks usually. But NIHMS has increased staff and improved some workflows, and I think we've seen some improvements. So we're working on it.
Thank you.
For people who don't want a full report, they're just really concerned about this one paper because a PI is making them crazy, there is a search by PubMed ID feature. It's always in the top upper corner of the compliance monitor. If you ever plug a PubMed ID in there and you don't get any results or it says there's nothing that you can view associated with that PubMed ID, it's because your IPF isn't associated with the paper, and in which case you're going to want to recommend the author get in touch.
Katie, we had someone who's new to the process. And actually asked you to explain what an IPF is.
It's an institutional profile number. Yeah, but what does the F stand for? Does anyone know?
I think it's just a Carmen's acronym.
Okay. The IPF is, right, so each institution has this number. I think the one I use generically in here, well, this doesn't help, is like 1, 2, 3, 4, 5, 6. But it's usually, I think, a 5 or 6 digit number that has been assigned to your institute and that ERA uses to make these associations. That's right. Poor explanation, but I think that's the level at which you just have to understand it. So hopefully that helps. Okay. All right. So if you're just trying to monitor one paper, you can look at these article details. This is the same information you're going to get if you download that report, just formatted in a slightly different way. So you have the IDs, the compliance status, citation information, NIHMS dates, and this is where I mentioned earlier, you can see the initial actor, which is the submitter, and the latest actor, which I have blocked out here, and then any associated grants. The 2 things I have highlighted here are the method A status and the initial actor, because these tie into the submission methods that we were mentioning earlier, and I know they can be a source of confusion. So one of the primary, well, no, I wouldn't call this the primary, but one of the sources of confusion is method A. A lot of folks notice that they're in a method A journal and they shouldn't have to do anything, and yet their dot remains yellow forever. And so I have a slight explanation for this, and it won't explain away the problem entirely because sometimes publishers are just late submitting. But there's a nuance here in that Method A, these are PMC participating journals, but there are actually two levels of PMC participation, and one of them is full participation, which means the publisher is going to submit all articles regardless of funding at the time of publication, and the author is not going to have to do anything. The second level is the NIH portfolio level, and in this case, the publisher has agreed to submit NIH-funded material at the time of publication. I've highlighted some boxes in green because this is where the two sort of diverge. So if a publisher is an NIH portfolio journal, doesn't know about the NIH support, they will not be submitting the article. So if you notice that an NIH-funded article has just remained yellow, even though it's Method A, it's probably best to follow up with the publisher and just poke them and say this was NIH funded and needs to be deposited to PMC. The other way you can do that, as long as the PI has made the association in my bibliography, we pick it up on our side, and our journal management team will follow up with the publisher and let them know as well that it has NIH funding. So at the bottom you'll see links. The Method A journals list is on the public access website, and you'll find it in the wizard when you figure out your submission method. If you're unclear on what a journal's participation level is, though, you'll want to look at the journal list in PMC. The last column of that table will tell you what the journal's participation level is. The other tricky one is with publishers who start NIHMS deposits, or the Method D publishers. So this is a case where the publisher starts the deposit, the manuscript meets the criteria of the public access policy, and they're aware of the funding. And they're supposed to do this at the time of publication. But there is more author responsibility involved here. First of all, they have to let the publisher know that there is NIH support. They need to make sure they've associated funding with it in some way. They'll have to approve the deposit, and then they'll also have to approve the PMC version. And a PMC ID will be assigned once this process is complete and the final publication date is available. One of the caveats here is that we don't have formal relationships with these publishers, so it's different from Method A in that we have signed agreements with publishers in this case. Method D is just something publishers do to try to help their authors, but the author and awardees are still responsible for ensuring that the manuscript is deposited. So if you notice if no one has gotten an email notification from NIHMS letting them know it's in the system, you'll want to follow up with them.
I have a question that came in about this, Katie.
Sure.
Is the default contact author the corresponding author? And what happens if that author doesn't have an ERA Commons account? How can they get on the NIHMS and process the paper?
Okay. I feel like there's a couple levels there. Which way? All right. Okay, so once a Method D publisher starts a submission, part of the package that they send, NIHMS, includes an author's name and email address. We use that email address to notify the author that they need to come in and approve the deposit. I believe 4 reminders are sent out, 1 a week. If you haven't responded after 4 weeks, we kind of stop spamming you, but we will send out a notification to everyone associated with that record, although in this case it's probably only the author at that point, that the deposit has been stalled. And so this is something that you can look for in PACM as well when you see those dates. Anything beyond a month means NIHMS reminders aren't being sent out anymore, and so you'll either want to ask NIHMS to start those again or reassign the record. That email notification to the author includes a ticket number link that they can click on. It'll take them directly to the page they need to go to. And the author just needs to associate any funding with the paper and approve the deposit and sign off on the submission statement.
So they don't need an ERA Commons account?
No, you can log in through MyNCBI, NIH, or ERA Commons.
And you don't need an ERA Commons account to have a MyNCBI account?
Correct.
You only need an ERA account to access the award view on MyNCBI?
Yes.
Okay, thank you.
There were a few additional questions. Sometimes publishers don't upload manuscripts in time. So they show up as non-compliant. Is there a status to reflect that the PI has done everything and is waiting for publishers? Is this common in other places?
There's no special status for that, Katie. The paper is out of compliance, and all the awards that funded the paper are out of compliance. It is the awardee's responsibility to make sure that paper is submitted on time, submitted upon acceptance for publication. It's not the publisher's responsibility. Their funding isn't at risk here. If the paper isn't submitted on time by the publisher, then the authors need to figure out how to get that paper submitted.
Okay. And related to that, what practice do you recommend for getting papers from Method D publications into NIHMS?
Well, I recommend two practices. The first is to make sure that the publishing agreement or your institution's publishing policy allows you to get that paper submitted if the publisher doesn't follow through. And you'll notice that some of these publication agreements don't actually specify when they're going to deposit the paper. They just say that they will deposit the paper. You are held responsible for the when, not the publisher. The second thing is, if there is a problem with the publication agreement, I do recommend that the institution work with the publisher and not the author themselves, because you're talking about a legal contract, and the author isn't necessarily the best person to represent themselves in that legal discussion, especially when an NIH award may be involved in this contract issue. Did you have a question as well, Cynthia?
Yes, we had one come in. They said in the packing, if it's a Method D and the only step has been the deposit by the publisher, what appears in the NIHMS person field?
It will probably be blank. When a deposit is started by a publisher, we have a name and an email address, but until they log in and actually take ownership of the submission, that data I don't believe is fed back to PACM. In those cases, I actually would recommend one of the other features that I didn't make a slide about, but is if you have an NIHMS ID and you want to follow the progress of that submission, you can log into NIHMS again through a MyNCBI account or whatever you have set up and search for that NIHMS ID and request to watch it. And watching it means you have access to the status of it and some of the players and the history. So there are ways of getting additional information if you're not finding what you need in PACM.
Okay, if a NIHMS ID has expired, does the process begin all over again?
There are no expiration dates on NIHMS IDs per se. The one thing that will expire is that ticket number that I referenced. So if a publisher has started a submission, the email notification is sent and there's a ticket number in the email. If it's not used in those first 4 weeks, I believe, that may expire. In that case, just write into NIHMS and they can revive it and help you get in, or just associate the record with your account so you can log in through your normal way and see it.
Okay, just a couple more quick ones. Can delegates approve deposits or final version, or just the authors?
Just authors. If an author isn't available, the PI can do it in support of their grant, but it does need to be someone who can speak to the science and review the published version and is familiar with it.
Okay, one more question. If we find publications in PACM that are exempt from the public access policy, and they said, i.e., accepted for publication before April 08, or the submission was not peer-reviewed, how could we get them removed?
You'll have to ask the PI who's associated with the paper at your institution to go into my bibliography and go through the standard steps of marking it as either not peer-reviewed or pre-2008, and once that exclusion is made there, PACM will pick it up.
We have an FAQ on that, so you can always send them the URL for the FAQ.
Okay. All right. So just kind of to sum it up, compliance monitor data, a lot of folks want to know how it's being used successfully at institutions, and I can say that some institutions are using it marvelously, and their compliance rates show that. Unfortunately, we put this data out there and we don't always know how it's being used. So we encourage people to distribute downloaded reports to departments and colleges. We're trying to find ways to make it easier to filter those reports. A lot of institutions are also setting up email reminders for PIs based on the grant cycle and the information they have from the compliance monitor. But more importantly, everyone who has this question should definitely register for next week's webinar, which is the NIH Public Access Policy, Views from the Library Trenches, because those will be actual case studies. If people ever want to send me feedback on how you're using it, I would love to know. I know there is a large community that's always looking for ways of how to use this data effectively, because it is a lot of data. And for large institutions, you have a lot of papers and a lot of grants and all this data, and managing it can be a challenge. So I think the more we can encourage sharing how this is done, the better.
And I think slots are limited to this one, so you do want to make sure you register and try and watch in a group if you can. I'm looking forward to this one. Should be good.
And then data.
Yes, real quick. So some of you have been hearing about this Office of Science and Technology directive to have public access policies for all federal agencies and for data sharing. So that's something that this is in response to. NIH has a data sharing policy. It's been the same since 2003, and we have not made any changes to it. We require data sharing plans for large awards, that is $500,000 or more in direct costs in any year. These data sharing plans are not a factor in peer review. And then, of course, we have specific program announcements and funding initiatives that require data sharing, and those are on a case-by-case basis. We do have a data sharing website. If we do make changes in our data sharing policy because of this White House initiative or other activities, we'll also announce that in the NIH Guide for Grants and Contracts. And again, we'll announce it well in advance of when it takes effect.
All right, so this last slide is just some resources that we've mentioned, both about the policy, the manuscript submission system, and then PubMed Central, where all of these papers are going.
That's right. Then that was our formal presentation. And if we have any more questions that have come in, we can take them in the time we have.
Okay. Here's one. You mentioned
okay. Here's one. You mentioned that PMC will format papers as an author's manuscript, even if it's the publisher's version. Does that mean the publisher's branding is removed?
Yes. Their branding is removed. It says NIH author manuscript, I believe, on the side and on a banner.
Right, and that's only for when they come through the manuscript submission system. If it's a PMC participating journal, they get to keep their own branding that they've set up.
Okay.
Okay. I've noticed that for some faculty members, the My NCBI becomes populated with their publications automatically. For others, the faculty member has to manually enter the publication into their bibliography. What's the difference between the two?
This is actually also covered in the FAQ, so if I fumble the ball here, you can double check me there. But if one of the authors on the paper comes in, and the PI might not be the author comes in and makes the association with the PI's grant, the PI, when they log in next, will see that paper in their bibliography, and they have the choice to keep it or say, no, this was made in error. In other cases, there is no, that only happens when there is data for my bibliography to pull. So if a citation exists but no one's made a grant association with it yet, then that will not automatically populate. That will have to be done manually. So it kind of depends on what the authors of the paper and other people involved are doing in the system.
That's right. So if I'm a student of Katie's, for example, I write a paper, I could acknowledge it, link it to her award in the NIHMS or in my bibliography, and linking it in either place will make that paper appear in her my bibliography account.
Okay, why would a publisher or journal not submit an article? Could it be that they don't know that if it's grant supported, or does the author have to contact the publisher each time their article is accepted?
Well, it depends on the submission method, I think. I guess maybe 30% or a small fraction of the papers we get through the manuscript submission system are submitted directly by the authors because their publisher or their journal has no connection with the manuscript submission system and they do not submit papers. In the other case where the journal says they're going to either submit the manuscript to the NIHMS or they're going to submit the final published article, these are complex organizations. They got lots of different operations, and sometimes they just miss stuff. And I think most frequently they miss stuff because they don't realize the paper is NIH funded. And so it has to be clear to the journal when you're signing that publishing agreement that they know and you know how this paper is going to get into PubMed Central.
Okay, I think we have time for a couple more. Regarding an NIHMS ID and withholding funding, does it matter if the article is 3 months past publication?
Yes, it does. So papers are provisionally compliant from acceptance to publication to 3 months after publication if they have a manuscript submission system ID. So if you haven't started the submission process at all and there's no NIHMS ID, that paper is out of compliance and your funding's at risk. If you submit that paper to the NIHMS, it's provisionally compliant with that yellow status for up to 3 months after publication.
Okay, the final question has to do with the help desk. The question is, how many people staff the help desk and what is the average time for getting a question response?
Well, we have several help desks. So we have a help desk for the policy, which is public access at nih.gov, and that's actually staffed by another help desk, which is not related to public access. So there's lots of coverage for that one. But you know, sometimes we get a question and we have to forward it or discuss it amongst ourselves. Generally, we try to get to things within 24 to 48 hours. I think 24 hours is pretty typical. But there are other help desks which the Library of Medicine runs, and Katie, you might want to...
Sure. There's the NCBI help desk, which is where most questions on my NCBI and my bibliography should go. And likewise, there's the NIHMS help desk. I can't speak to the turnaround times for the my NCBI help desk, but NIHMS, I think, is pretty much within 2 to 3 days right now. If you don't get a response in that time, feel free to resend it. It's not a problem if you email multiple times.
And if you find that you're getting bounced between help desks or something's getting confused, public access at nih.gov is also meant to be the policy help desk and the one that can negotiate where papers seem to be getting stuck across systems. We can do referrals and call people together.
Well, great. Neil and Katie, thank you so much. We've run out of time. Thank you for all of those who joined us today and for taking time out of your busy schedules. We know your time is valuable, and we hope that you found the information in this webinar helpful. As a reminder, you'll find the PowerPoint and the recording of the webinar at publicaccess.nih.gov in approximately 3 to 5 days. That concludes today's webinar.
Thank you, everyone.
Thank you.